We're all about getting to the heart of things here, right? Cutting through the noise and finding that information that really matters. Well, today we're doing exactly that. We're taking a deep dive, really getting into it, with this article called How to Conduct and Publish Systematic Reviews and Meta-Analyses in Dentistry. It's by Pratt and some other folks from the Journal of Aesthetic and Restorative Dentistry. You know that journal.
Yeah, familiar with it for sure. And you're right, as dentists, we're always getting hit with new studies and materials and techniques. It can be a lot to keep up with.
Mm.
This article gives us a way to make sense of it all, like a framework. Helps us figure out how these systematic reviews can actually make our lives easier and help us make the best choices for our patients.
Okay, so let's break it down for all the dentists out there listening. Why should we even care about systematic reviews? What's in it for us in our everyday practice?
I think a good way to think about it is this. Imagine you want to know the absolute best way to treat something, right? Or maybe you're trying to choose the most reliable material for a procedure. Now, you could spend hours and hours reading tons of individual studies. Or a systematic review could do the work for you.
Okay, I like where this is going.
It takes all those relevant studies, all the good quality research, and boils it down. You get this nice, concise summary, an unbiased view of what the evidence is actually telling us. It's like having a super smart colleague who's read everything and can just give you the bottom line. And in dentistry, things are changing so fast, new technologies, new materials all the time. We need a solid foundation to base our decisions on, and that's where these reviews come in.
So it's not just a summary, it's more like a really carefully thought out evaluation of all the evidence.
Exactly.
And the article talks about other types of evidence synthesis too. Should we maybe touch on how those are different from systematic reviews?
Yeah, we can do that quickly. You've got things like scoping reviews, which are good for getting a big picture overview of a topic. And then there are rapid reviews, which are helpful when you need answers fast. But when it comes to really in-depth, rigorous analysis, the kind that guides our practice in the long term, systematic reviews, especially the ones with meta-analyses, those are the gold standard.
And meta-analysis just means they're combining the data from all those studies, right?
Right, using statistics to get an overall picture.
Okay, got it. So for today, we're really focusing on the kind of systematic reviews that can have direct impact on what we do in the operatory.
Exactly. Making a difference in our day-to-day work.
So the article uses this example of a systematic review comparing different ceramic materials for crowns and bridges. Can you talk about why that would be so useful for us?
Oh, absolutely. I mean, think about it. We're choosing materials all the time.
Right.
Every single day. And this particular review looked at how often crowns and bridges made from different ceramics failed, like lithium disilicate, zirconia, polymer-infiltrated ceramic networks, all those different options. A good systematic review would gather all the studies comparing those materials and give you a clear idea of which ones actually perform better over time.
So it takes the guesswork out of it.
Yeah, exactly. It's not just about what the latest shiny new material is. It's about using what actually works. What has the evidence behind it? So when you're talking to a patient about a crown or a bridge, you can confidently recommend the option that's most likely to be successful and avoid complications, right?
That's a huge help.
It really is.
So these reviews, they're not just some theoretical concept. They can answer those practical, everyday questions we have. And the article even has a table listing different types of questions that SRs can address. What were some of the ones that stood out to you?
What I find fascinating is just how many different kinds of questions they can answer. You can find reviews that look at how common certain conditions are, like edentulosum or caries prevalence.
Yeah.
Then there are others that dive into what causes dental problems in the first place, like is there a link between certain ceramic materials and enamel wear?
Interesting.
You could even find reviews focused on diagnosis, comparing different ways to detect things, like is CBCT more accurate than regular radiographs for finding caries? And of course, lots of reviews focus on treatment effectiveness, like how well do partial coverage restorations perform, things like that.
Yeah, that's what we're always looking for. What works, right?
Exactly. And some reviews even look at prognosis, trying to figure out what factors might influence how long a restoration will last.
Like, will this composite filling hold up for 5 years, 10 years, 20 years?
Yeah, exactly. The whole spectrum is covered. It's really impressive. What kinds of questions do you find yourself thinking about most often?
I think for me, it's those treatment and prognosis questions. We all want to know what's going to work best and how long it's going to last for our patients.
For sure. Those are big ones.
Now, the article goes into quite a bit of detail about assessing the certainty of evidence. They talk about something called grade. Why is that so important for us when we're reading these reviews?
Well, think of it this way. You're reading a systematic review, and you see the conclusions. But you don't want to just blindly accept them, right? You want to know, how confident can I be that these conclusions are actually true? That's where grade comes in. It helps you figure out how much weight you should give to those findings.
So it's about being a critical thinker, not just taking things at face value.
Exactly. You're evaluating the evidence.
And grade, that's GRADE, right? Can you give us
Deeper.
the rundown on how it works?
Right, GRADE. It stands for Grading of Recommendations, Assessment, Development, and Evaluation. Sounds complicated, but it's not really. The main thing to remember is that grade looks at the certainty of the evidence for each specific outcome in a review.
Okay, can you give me an example?
Sure. Say a review looks at pain and swelling after a procedure. The grade rating for the findings on pain might be different from the rating for the findings on swelling.
Got it. So you could have strong evidence for one outcome, but weaker evidence for another, even within the same review.
Exactly. And here's another important thing. You see a systematic review that includes randomized controlled trials, those RCTs. And you might think, oh, RCTs, that's the best evidence. It must be high certainty.
Yeah, we always hear about how RCTs are the gold standard.
They are. But there are still some things that can lower the certainty, even with RCTs. Grade takes those things into account.
Like what kinds of things?
Well, one thing is the risk of bias in the studies. For example, if the patients or the clinicians knew which treatment they were getting, that could influence the results.
Yeah, I can see how that would skew things.
Another factor is inconsistency. If different studies on the same topic are showing wildly different results, that makes us less confident in the findings. And then there's imprecision. That often happens when you have too few patients in the studies.
So the sample size matters.
It does. And then there's indirectness. That's when the evidence doesn't quite line up with your specific clinical question. Like maybe the studies were done on a slightly different population, or they used a slightly different technique.
So it's not a perfect match for what you're trying to figure out.
Right. And finally, there's publication bias. That's the concern that studies with negative or inconclusive results might not have gotten published. So we might be missing part of the picture.
Okay, so just because a review includes RCTs, it doesn't automatically mean we should just take the conclusions as gospel.
Exactly. It's all about looking at the bigger picture. Now, what about studies that aren't randomized, those observational studies?
Right. Where do those fit into grade?
Well, typically evidence from non-randomized studies starts at a lower certainty level. But here's the thing, and this is important sometimes, that certainty can actually be upgraded.
Upgraded. Really?
Yep. There are certain situations where we might be more confident in the findings from an observational study. For instance, if the study shows a really big effect, like the treatment made a huge difference.
So a dramatic result might make us more confident, even without randomization.
Right. Or if there's a clear dose-response relationship. That means the more exposure to something, the greater the effect. Or if we can see that all the potential biases would actually lean toward underestimating the effect. In those cases, we might feel more confident about the findings, and the grade rating might get bumped up.
So understanding grade is not just some academic exercise. It's about knowing how much weight to give the evidence.
Exactly. And that directly impacts how you make decisions for your patients. You need to know how confident you can be in the results. That's why you often see grade assessments presented in these summary findings tables.
Those are in the systematic reviews themselves.
Yeah, a lot of the good ones have them. They give you a quick snapshot of the certainty of the evidence for the key outcomes. Super helpful.
Sounds like a good thing to look for. Okay, now the article also talks about something called PRISMA. What is that, and why is it important for dentists?
So PRISMA stands for Preferred Reporting Items for Systematic Reviews and Meta-Analyses. It's basically a checklist, 27 items long, and it guides researchers on how to report their findings.
So it's like a set of standards to make sure the reviews are clear and complete.
Exactly. PRISMA is all about transparency. It's not about telling researchers how to do the review itself. It's about how they present their findings so that others can understand and evaluate them.
Got it. Makes sense. So what are some of the key things that PRISMA covers?
Well, it covers everything from the title and abstract, which should accurately reflect what the review is about, to the introduction, which should lay out the rationale and the objectives. The method section is super important. It should clearly describe how the researchers selected the studies they included, the search strategy they used, how they collected the data, and how they assessed the risk of bias in the included studies.
Sounds very thorough.
It is. The results section should give a complete overview of what they found, and often includes a PRISMA flow diagram. And the discussion section interprets the results, talks about any limitations of the review, and discusses the implications for practice and future research.
You mentioned a PRISMA flow diagram. What's that all about?
The flow diagram is a visual representation of the study selection process. It shows you how many articles the researcher started with, how many were screened, how many met the inclusion criteria, and how many were ultimately included in the review. It also shows you the reasons why studies were excluded at each stage.
So you can see exactly how they got to their final set of studies.
Right, and you can judge whether the process was unbiased and thorough.
Okay, so if we know what a good PRISMA-compliant report looks like, we're in a better position to judge the quality of a systematic review. We can be more confident that we're using good, reliable evidence.
Exactly. When a review follows the PRISMA guidelines, it shows a commitment to transparency and rigor. Makes it a lot easier to trust the findings.
Okay, so we've covered a lot of ground here. We've talked about why systematic reviews are so important for dentists, how to assess the certainty of the evidence using GRADE, and how PRISMA ensures transparent reporting. But let's bring it all home now. For the dentists listening, what are the key takeaways? How does this knowledge change what we do in the clinic?
Well, I think the biggest thing is that it helps you become a more informed consumer of research. You're not just reading a conclusion and saying, okay, I guess that's true. You're looking at the grade rating, you're understanding the strength of the evidence.
So we're more critical, more discerning.
Exactly. And that allows you to have better conversations with your patients. You can explain the benefits and the risks of different treatment options, and you can tailor those conversations to their specific needs. If the evidence for a new treatment is uncertain, you might be more hesitant to use it, or at least you'll have a very frank conversation with your patient about the limitations.
That's so important. Managing expectations and making sure our decisions are truly evidence-based.
Absolutely. And understanding PRISMA helps you evaluate the quality of the reviews themselves. You can quickly look for a flow diagram, a clear description of the search strategy, and assessment of bias. Those are the hallmarks of a well-conducted review.
So we can quickly weed out the not-so-good ones and focus on the ones that are more likely to be reliable.
Right. And in the end, that saves you time because you're not wasting time reading reviews that might not be that great. You're focusing on the good stuff.
Efficiency and effectiveness. Two very important things.
Couldn't agree more. And in the end, it all comes back to providing the best possible care for our patients. When you can confidently interpret these systematic reviews using GRADE and PRISMA, you're making informed decisions, and that leads to better patient outcomes.
And the article's abstract makes that very clear. They say that well-conducted systematic reviews give us high-quality evidence, which leads to better clinical decisions and better outcomes for patients. And it saves us time and helps us put that knowledge into practice.
I couldn't have said it better myself.
So to wrap things up, we've seen how valuable systematic reviews are for dentists. They help us stay up to date and make informed decisions. We've learned about the importance of assessing the certainty of evidence using GRADE and how PRISMA makes sure those reviews are transparent and complete.
And we've talked about how this knowledge translates into real-world benefits for our patients.
Exactly. It's not just theory, it's about making a difference in people's lives. So here's a final thought for you to consider. Think about all the new materials and techniques that are constantly coming out in dentistry. How do you think your understanding of systematic reviews and those tools for assessing quality, GRADE, and PRISMA, how might that change your approach to patient care and how you approach lifelong learning in dentistry? It's something to ponder as you navigate this ever-evolving field. Maybe even take a look at a systematic review in your area with these new tools in mind. Thanks for joining us for this deep dive. We'll see you next time.
See you then.